So what would you say, these days a lot of very young girls in their 20s have Botox already.
Like yourself.
Yes, like me. So is that good or?
Okay, so almost strip back the question a bit. The first thing is Botox isn't just for lines, it can also be for if you've got really downturned mouth corners, if you've got a gummy smile, if you've got really strong bruxism, clenching.
Yeah.
And there's some people who've got women who have really angular faces, like yours was subtle and it's improved. But so for all of those reasons, I think it's absolutely fine. Then the second thing would be, so that's for changing face shape with Botox.
So like correcting things, yeah.
Now, then the next bit, and headaches and anti-sweating, all of those things, I think, of course. But the question probably more is women who are having it purely for wrinkles at an early age.
Does that prevent then wrinkles
Of course, it's the same as sun protection. They're the two things. So if you don't crease your face and you avoid the sun, then you're not really going to age.
So it's okay. And any risks with Botox?
Well, okay, so the ruling is not before 18. So just about all docs agree don't do it before 18. And I think if somebody came to me and they had no lines and they were 22, I might say to them, why don't you come back? Mid-20s, late 20s.
Yeah. So, but there is no any side effects of Botox?
There are. Well, there are. There are. So if I was consenting you and we were doing what you have normally around the eyes, I'd be saying to you, there's a very small chance you could get a heavy lid. Not the brow, the lid. And why does that happen? Droopy lid. And if you've seen any pictures, it's not good. And it lasts for about 3 months. And you can't open your lid properly. You can use eye drops to improve it a bit, but
why does that happen?
Why would it be a mistake? Too deep? Or if you get a bit of bruising, it goes across, because basically the muscle that does your lid is deep to the other ones.
Oh, so you basically paralyse that muscle?
Yeah.
But it's temporary, isn't it? Because Botox wears off.
Yeah. So and the reasons it tends to happen, if a bit of inside knowledge is, there are some types of botulinum that are more likely to cause it. There's one called Azalor, it's a bit cheaper. And the times when I use that one is some people, have you ever heard that people get, they build up resistance to certain brands of Botox, so you can do. So you can build up resistances, and it's not the botulinum, which is not the brand, that's the toxin, it's the additives in it.
Oh, okay.
And what tends to, me and my friend worked at Mark Holmes, give a shout out to him, sort of one of my mentors.
Mark Holmes?
Holmes, lovely guy. So when I started out, he was one of the guys who I'd go to and ask for help, because you always need a good mentor when you start. Yeah. And I use his protocol, and that's if somebody comes and it's not working, which does happen, so they've had Botox for years and suddenly there's no effect, you take them off that brand, you put on another one twice, so it's for like 2 cycles, and you can go back to that one again, and it works really well.
Okay. I didn't know that you can, but that's probably people, they use it a lot, like every 4 months or something. It
is. So another side effect, as well as asymmetry or drooping, is if you do it too often, what ends up happening is your receptors get full up, they get saturated, and then the botulinum flows around the bloodstream and antibodies are built up. So the antibodies then prevent you having the same reaction. So that's how you build up resistance.
So now I've got this question, when you have Botox, do you wait for it to wear off completely before your next treatment?
So very simply, for most people do it every 4 months. That's the start. Yeah. Most people do it probably 6 in actual fact.
I do 6, sometimes 8.
Well, part of the reason is if you have done it for a while, you get the atrophy, which is that the muscle gets weaker. So it does start working, but it doesn't work with the same strength. So although you are getting a bit of creasing, it's not as marked as it was before, but your muscles will be working within 4 months.
Okay.
And don't do it unless you can obviously see movement, don't do it more often than that, and you get the problem of the same where you get antibodies, and then you don't get the same response.
But 6 months is okay?
6 is fine, it depends what you're trying to do. If you're if you're a kind of catwalk model like yourself, I'd say do every 4 months.
Catwalk model.
But otherwise, 6 months.
Can you use fillers for an inverted V on a nose bridge? Or is it right up on a nose bridge? I wonder if people mean here, where you get that little...
No, so the simple answer is you can pretty much do... So the only thing you can't correct really well is a massive sideways asymmetry.
Yeah.
So a lateral deviation. Most of the dorsal hump stuff you can correct much better than people think. and I do
With filler.
Yeah, and I don't do so. Rhinoplasties again. You think plastic surgeons could do them normally.
Yeah.
It's part of our training that we're doing less and less. Obviously, you don't see it in the NHS so much. So I do them, but I do them with consultant bosses because they're such difficult operations.
So you almost like specialise. You
Exactly.
specialise
That's it. So
in
you should do.
rhinoplasty, yeah.
That's what you do. You know, it's much harder than a facelift. Much harder. If
I can imagine. You have to break the nose.
Yeah, and if you get it wrong, but with filler, you can pretty much do everything. So I don't think there's much of a call for an operative rhinoplasty unless you have a big deviation.
Yeah. Right. So inverted V with filler, no problem.
You can correct.
Oh, this. A lot of people had a big problem with that. That when you were injecting me, I had full face of makeup. That I wasn't clean. What's that about?
So a few things to remember. You can have a sterile field, you can have surgical gloves on, but if your needle isn't sterile, where you're injecting, and the site isn't sterile, then it's irrelevant, and people do this wrong all the time. So what they won't have noticed was, when we're doing your cheek, for example, we'd made the site where we were injecting sterile, and not only that, but and people miss this all the time, where we were coming back and forth with a cannula, I'd put a little swab there.
Yeah, I saw that.
And I'd covered that with antiseptic stuff, so that you're not carrying.
So when the needle comes out,
It's
doesn't
being
pick up.
Yeah, and you'll see, and then you see it. So when I'm training people all the time, you see it all the time. They'll do this elaborate field, and then they'll touch the needle on something, or they'll bring the needle back out and they'll hit hair, and so
Yeah.
That's really
Okay. Yeah, I remember seeing. I was wondering why you've got that.
And what we were doing was, wherever we were injecting, we were dabbing with it antiseptic stuff before going in and cleaning the makeup up on that.
I did reply because obviously the video where they saw you treating me, it wasn't the whole treatment. It was very cut. Short, Of course, when you were injecting, you were disinfecting it. So.
And the interesting thing is also, when you train, like you'll say to people, okay, don't put any makeup on after the filler. But the thing is, you're going to, like, the average person gets straight and they can't put it on. So what I say to people, realistically, I think I said it to you, is if you can buy some new makeup.
Oh, okay.
And if you have pets, try to not let them get on the bed with you tonight. Wash your sheets. They're the little things that actually make a difference. Yeah.
What's better and less expensive, filler or your own fat? So you can fill with your own fat, can you?
It's always going to be more expensive to use your own fat because of the equipment involved. Also, so what are the advantages and disadvantages? So the first thing is, cost with your own fat is going to be more expensive per se, unless you go to somebody who's charging inordinate amounts of filler. But at my cost, it's a lot cheaper to do with filler. However, it's cost over time, I guess you could ask, because fat is theoretically permanent.
Oh, okay. So
you're going to repeat filler, aren't you? And so the big advantage of surgery is it's got a degree of permanence. I mean, even a facelift will give way over time.
I don't know if people mean that if it's the vampire lift
It doesn't. I would say that outside of, so in the non-surgical world, the only thing today, we talked about threads, that really gives the effect and contour lift that people want is filler.
So you couldn't take filler out of my butt and inject it in my cheeks?
You can do. You can do it with a closed system. Now, the disadvantage of trying to do it with fat is that fat's much more conformable. So especially with you, getting those sharp cheeks, you're not going to get that with fat.
Yeah, because I'm a very difficult case.
I mean, your fat would probably be very hard to produce that, but super contouring fat.
He's so horrible to me.
But no, that's the problem. So it's too conformable, so it doesn't quite do what you want, and you need bigger volumes. So in general, like this whole idea of sharpening your cheeks and your jawline, you can't do it with fat. If you've just got a general loss of volume, you can do it with fat nicely.
Mm-hmm. Oh, do you need a test for an allergic reaction to the fillers? No, it's hyaluronic acid, isn't it?
It's what's naturally in your body. Now, could you have a mild reaction to additives or things that are in there? Theoretically.
Yeah.
I've never known anyone to do it. The things you tend to ask for, pregnancy, it's a theoretical one. What would it do? The local anaesthetic, something might have an effect.
Baby will come out with a very small
looking ridiculously pretty. Really, really, really cute kid.
Let's enjoy that. question.
Anyway, moving on. Yeah. Next
Yeah.
question.
Are there any allergies or adverse reactions to fillers?
Theoretical ones, but the risks are more to do with your skin condition. If you've got cold sores, if you've got any active acne at the time. So people who come and see me, so if they've got anything active, just delay it. I
Okay.
think we talked about that actually at the time.
Now I have no acne.
That's what I meant. And if they have it 3 times a year, sometimes I'll say some prophylactic to take some acyclovir, antiviral stuff. But in answer, not really.
No.
There's no major worries.
Okay. What about sagging chin? What do they mean sagging chin?
So I think
Maybe
I
this.
think the jowl and there. So we talked about that earlier. So the best thing non-surgically is this Aqualax Kybella.
Yeah.
There's loads of great results with. I haven't had an experience with it only because it's only just come out in the UK,
Yeah.
and that's a bit hot off the press. And the other things are contouring with filler.
Okay.
I think the thing people hope is going to work
Liposuction.
Yeah, absolutely. Surgically, yeah. There's loads of surgical things you can do.
Can you fix jowls without changing jaw shape?
So chin shape, definitely.
Jaw.
Okay, so let's talk. So we talked about what the jowl was before.
Yeah.
So you've
Jowl
got this.
is here, yeah.
So you've got this
You
little
can show it
retaining.
on me.
So you haven't got one. So
Oh, yeah.
So turn you to the side just a little bit. So and actually yours, as we showed on the photograph, has gone really nicely because.
If not very.
So you've got a little ligament here that goes from the jawbone to the skin, out like that. And because of that, you get a crease.
Mm-hmm.
You can just see it just coming in there. That also lines up with the nasolabial line, the marionette, and all the way down. It's kind of continual line.
Yeah.
Now, we've smoothed yours off nicely. The reason that comes in is that as gravity and fat comes down, it then pivots on this point
Yeah.
because that's all a bit tighter. So what you're basically doing is you're pulling up the skin tight from that point. It's not really, so it shouldn't affect the chin too much. If that, that's the first part of the question.
Yeah.
That's sort of separate. So what you're trying to do is pull back this way. And so, yeah, you can.
So basically you can get rid of jowls without changing the shape of the jawline.
Yeah, you can.
Because also you inject somewhere here, don't you, for jowls?
Yeah, so well,
Would that
so part of the improvement in your jowl was the cheeks.
Okay.
It doesn't take away.
What
from
about Botox under here? You see, I hear some doctors will inject under here, some won't.
You can inject under there. So what are you trying to achieve? Again, you've got this circular muscle, and you're just trying to soften its effect. The worry is that you can drop the eyelid. That's what people are worrying about.
Okay.
And you've got a bit of clot work. That's actually, if you look at your pupillary line, it's inside that. And as long as you're outside of that, you're pretty safe. The second factor is not dropping the eye, but as long as you do superficial small doses, you can improve it. And again, it's a 10-20% improvement. You're not going to improve it completely.
Because I heard that if you inject Botox down here, it paralyzes this muscle and then you might have a funny...
So what you're talking about is knocking out the muscle below the zygomatic one. So you've got this whole cheek complex, and you don't want to knock out the one so you can get an abnormal smile.
Oh, right.
Drop the lip.
That happened to someone I know.
Yeah. And that's
She
where
was
you. That's how you
like
both.
paralysed on one side.
Yeah. And it's the same when you were talking about gummy smiles and lifting the lips. If you inject in the wrong area, you can get.
So again, you just have to know
Know where you
what
are.
you're doing. Is there any age limit for fillers and Botox?
So generally, good practice is not to do it below 18, which we talked about a bit earlier. And in terms of the upper limit, not at all.
No.
No.
How much pain is involved in having eye surgery? So proper.
Okay,
blepharoplasty.
Yes. So the upper blepharoplasty, I think, is something that's not employed enough because people try to live forever with a Botox brow lift, where a lot of the time their brow position, like your brow position, for example, is nice. You wouldn't want it any higher.
No.
So you're at a point now where you don't need to. But if the heaviness in the skin in between here would start to bother you, it wouldn't be a brow lift. It would be excising the skin. They're really easy. Do them under local. Minimal pain. You inject local. The injection is maybe 4 out of 10 for 10 seconds, 20 seconds, then you don't feel anything. So don't.
Okay.
The lower one, however, you can theoretically, and a lot of the ENT surgeons do it under local as well, but generally people do it under a general, so the pain's not a factor.
Okay. And afterwards, is that painful?
No, it's swelling and downtime, so it's not pain so much. It's more that you're not going to want to do anything for about 2 weeks afterwards.
Is Revolax available in USA?
No.
What's the next best thing for under eyes and cheeks?
So it's any thin filler that's got a good track record. And I would actually say what you want attached to that is not the filler, as long as it's a thin one, there's lots of good ones, it's the practitioner.
Right, so it's not the filler, it's the practitioner. But Juvederm, something like that, because I know that's used widely in America.
So the thin Juvederm.
Restylane.
Restylane alright, but they don't really have any that's quite thin enough. Restylane is more of an all size fits one. It's okay. So I've used Restylane before. So I would say the thin Juvederms, the fine Revelax, and the TSL. There are other companies.
Mm-hmm.
But as I said, it's all of the problems in tear trough come from using the wrong thickness of filling, putting it in the wrong place.
Is it too late for fillers at 68, wrinkly and sagging face?
No.
No.
If you saw some of my pictures on Instagram on people who are exactly that, you'd be amazed at what you can achieve.
This is interesting. Autoimmune disease, Hashimoto thyroiditis.
Yeah.
Someone has that. Can fillers set off an autoimmune reaction and reject the fillers?
I'm not aware of any interaction. I can't think of why it would. It's hyaluronic acid, unless it has some additives. I can't think of any reason why it would.
Okay. But should she tell the doctor that that's what she has?
Absolutely.
Yeah.
And in all honesty, she would be telling someone like me, and they're the same knowledge level I have, unless it's somebody who's like an expert in that.
In autoimmune
yeah.
disease,
So unless I'd have a quick look, but I can't think there's a problem. If I got that wrong, I apologise, but I think it'd be alright.
because it's just hyaluronic acid, but it could be the additives that could
There
maybe...
could be some interaction I'm not aware of.
But
I
it's
can't
not
think
like
of
a
anything.
huge risk of...
No.
Okay. Now, anaesthetic or not,
Yeah.
for fillers, the cream, and we talked about it. Believe it or not, I didn't have any numbing cream on.
So the reasons are, so it's understanding it again, it's anatomy. So topicals, you've got a few different ones. Emla, LMX, people might have heard of. LMX works quicker, this one I tend to generally use, so you need to leave it on for about 10-15 minutes. Now, why do you use it? You use it in areas where, how deep does it numb? So it only numbs the skin itself. And does it numb all of the skin? Probably not about half of it. So if you're doing it on the face and I put a needle in the skin, is it going to numb all of it? Not completely, so you're going to take the edge off. When we're using a cannula, which we used for about half of what we did, you're below the skin. So the reason I use the topical then is only for the little insertion points. You make a little hole, then you go in with a cannula. Now, if you remember, when you're in the right layer, so you're below the muscle, in the fat, you don't really feel much at all.
No, I didn't feel nothing. I mean, when you were doing my cheek with the cannula, I felt nothing.
You're aware of it displacing tissue, and there's an odd fat pad where you push through.
Yeah, that is really weird. It goes pop, pop,
But it doesn't. It's not pain. It's more. And weirdly, some of the people actually quite like it. They're almost sort of like, oh, they're quite. But now, so in the jawline here, and if we're using cannula, so topical becomes irrelevant apart from the puncture holes.
Yeah.
Under the eyes, I tend to do it not because, again, we're using cannula, not because it hurts so much, but just because it's a bit weird. And it's sort of nice for people to be a bit less aware of the movement.
So it's more psychological, I think, the topical cream than...
Exactly.
What about lips down?
Lips are tender with a needle. I've tried my partner Maya, who the two of us are in the same business.
Yeah.
She's some things. It's funny, in some people's hands they can just make it work. She can make cannulas work in lips in a way I can't, and she reports she gets minimal pain.
Right.
When I've done it, I get moderate. And I find it more difficult to control. So I tend to use a needle. I use cannulas more for safety around these lines because we talked earlier about where the blood vessels are. They are tender, I would say. The two areas that are the most tender are lips and the one injection on the nose. And you've had that one, so you know.
Yeah, in a nose.
Not
right
these
here.
ones.
No, this didn't hurt.
But
this,
that one.
yeah.
And we put topical on. It takes the edge off the injection, but once you're in an area that's tender, you can't.
Yeah, you can't numb it.
So then the topical's in the filler, isn't it? So how long does it take to kick in? It's not instant. It probably takes about 2 minutes. So whilst people will say the topical, it's got anaesthetic in.
Yeah.
It's still going to hurt.
Yeah.
What's going to happen is it means if you've had a bit in, you can leave it, and then the subsequent injections won't hurt. So that's the key.
So that because the Revolax has anaesthetic in it, so once it goes in after about 2 minutes, that starts working.
Exactly.
Inside.
Yeah.
Right. Someone had a face, neck lift, and chin augmentation in January, proper plastic surgery.
Yeah.
And still feels tight and numb. Is that normal, and how long the tightness?
So it's basically a facelift.
Yeah.
So so the nerves that supply everything in the face are below an area called the SMAS, it's like a thick fascial layer.
Yeah.
Generally, they shouldn't be interfered with depending on what facelift you have.
Oh, okay.
Now, when some people will actually cut out a bit of this SMAS, which the nerves are below, and hook it up. Some people will like plicate it, almost like bring a bit of it in. And when you're doing that, you can stretch the nerves and move them about. So often you will get a degree of numbness, but in the skin, that tends to be because maybe you've had an incision line. And if she means around like this area where she's done it, yes, that it takes a while because you've literally cut through really superficial nerves in the skin.
Can take months,
Can do, yeah.
So if it was January, it's May, what is it now? May almost.
Yeah.
Yeah, so probably quite.
And in all honesty, if the scars are back here, it's not your kind of biggest worry, really.
Yeah.
If you've got a teeny bit of numbness here, one of the bits that people worry about if they've had a neck lift is you can sometimes get numbness of your earlobe. It's a nerve that comes along here, and if that happens.
But will that come back?
Not completely. It can be permanent.
Right.
Yeah.
What do you do for under eye darkness that is hereditary on a light medium skin tone?
So you can improve it slightly if it's due to contour irregularity with filler. If it's due purely just to skin colour, and that's what we're saying, then hydroquinone can help because that stabilises melanocytes.
Yeah.
If, depending on the Fitzpatrick skin type, you can then use either lasers, there are other things, plasma, and by that I don't mean PRP plasma, I mean it's a type of machine. They work very well.
Well, the one little lasers that burn off the skin.
Exactly.
Yeah,
and they improve.
Do you like those?
They work. It's very, I do like them, and it's the best thing for pigment. But if you've got slightly more tan skin, you need to be on the hydroquinone for about 3 months before, because otherwise, remember we were saying about hypopigmentation.
Yeah.
So you can go the other way.
So really, you can't treat it with fillers, the darkness.
Not really, no. It's a skin care thing.
Is it true that the more fillers you have, the more it builds up?
So we
I don't understand the question really.
Not strictly. The truth behind it is if you have regular injections, remember saying you get a degree of fibrosis, you might always have a little bit of kind of plumpness that you didn't have before, despite all the filler having gone completely. But no, there are some instances where filler tends to hang around forever. We said like sometimes above the lip line, if it goes where you don't want it, it can be quite difficult to get rid of, but in general no.
Filler for bunny lines. Here, the side of the nose. What do you get? I don't have.
So you've got a little nasalis muscle. So if you do it, you can see. It's like a muscle that comes down here and it goes down there, and it's the same as all the rest. For you don't have any resting lines. The difference between resting lines, static lines, and active lines or dynamic lines. You've got no static lines there. If it doesn't bother you, why treat it?
Because I'm 20.
Yes, sorry, that's true. Yeah. So when you get into your late 20s, and this may then start kicking in. Not many people ask for it. It's an area that you treat the procerus here and you get a little bit of a kind of spreading effect, and that tends to soften it. And if someone's really got marked ones, you additionally treat it. It's two little injections on the back of the nose.
And that's filler?
No, Botox.
Botox?
Yeah.
Oh, so not filler for bunny lines?
Oh, no, sorry.
Botox? Yeah, because the question was filler for...
I misheard. No, Botox.
Botox for that, okay. Can you make face more symmetrical with fillers?
Well, of course.
So... This person says she has one side more square and the other side of her face is more heart-shaped.
So, asymmetric faces, so just everyone's asymmetric, that's the first thing, just about. Now, the most common thing you get is you get a cheek that's flat on the other, and that's because you sleep on one side. And the way you correct that is you can go a little bit more superficial with filler. For contours, we do you, or you can go a bit deeper to build up volume, where you inject right on the bone. Again, doesn't hurt surprisingly, or minimally. And so for somebody like that, of course, you look at it, you measure it, you have an artistic eye and you correct. That's very standard, that's not even complicated, that's like normal treatment. In your normal treatment of cheeks, for example, you would be looking at that.
It's really like being an artist, isn't it?
Very much so, yeah.
Oh. Do you use different concentration of Botox? And the question is because this lady used to her Botox used to wear off in 4 to 5 months, and now it wears off in 2 months. She's changed her practitioner, and now her Botox wears off in 2 months.
So the possibility with her is that she's built up a degree of immunity.
Yes, we talked about that. Oh, okay.
And that's due to 2 reasons most commonly. One, you just build it up to the additives of that Botox, and like people can get hypersensitivity reactions, just out of the blue. You find with something and suddenly you get hypersensitivity and you don't know why, it's just the body's weird. The other factor is if you've had Botox too often or too big a volume, because you've saturated all of the receptors and then you've got it flowing around and antibodies build up.
Oh, okay.
Both ways, the best thing to do is to, if it's the second one, you may just have to take a break. Usually though, it's just changing the brand of Botox for 2
okay.
cycles, we said earlier, and then
you can go back to the same one. Oh, okay. So you might have built up resistance to Botox if you've had it done for over a long period of time. So the thing to do is change the type of Botox for 2 rounds, and then you can go back to the old one. Or the person basically cheats you and puts tiny bit in.
Yeah, yeah. And they may be using, the possibility is they may, rather than it wearing off completely, it may be that there are some brands that aren't quite as reliable. So, I would say if you wanted to choose, Botox is the best. Bocaccio is very close.
So Botox is actual brand.
Yeah.
Because we seem to think of, it's the botulinum
botulinum toxin.
Yeah, toxin, but we call it all Botox, but they are different brands. So Botox is one of the brands.
And there's a reason, because I can just say in a kind of elitist way, the reason it's the best is it's the most reliably made. The protein particles are really good, even size.
Okay.
So it spreads very evenly. You don't tend to get all the the production line is very reliable, so you don't get bad batches.
Okay.
Bocaccio, very close second.
Bocaccio.
And that's nice, and practitioners like that, 'cause you don't need to refrigerate it. You have to refrigerate Botox.
Okay.
The only problem with Bocaccio is that sometimes you get the odd batch, very uncommonly, and it just doesn't work completely. It's very obvious, so you wouldn't need to worry as a client. You go back, and after a week you say it's literally not working. So
okay.
my apologies, must be a bad batch, and go again. Azalor, which is the one that I said earlier, the problem with that one is the particle sizes are much less reliably sized, and therefore it can spread where you don't want it to. And you're more likely to get problems like eyelid droop. Still uncommon, but that's the one whenever I've had it, it was when I used to use that in the past. The people are tempted to use it 'cause it's much cheaper than Botox.
Okay, so Botox is the best
It is really
out of the
three,
botulinum, yeah.
But if your practitioner uses Bocaccio, that's very reasonable, because they're very similar.
Is it Bocaccio?
Bocouture.
Bocaccio. And the third one was?
Azalor. And personally, I don't like that very much. And the times when I use that, and my friends use that, tends to be if you build up resistance to the other ones and it's a break.
Because also we have to remember, because I suppose we watch different practitioners doing fillers, you can see it all over YouTube, and you can tell, well, he does cheeks this way. There is no right way or wrong way, is it?
No, but I think there are some base principles to understand.
Yeah, there are principles, but you will have preferred way of injecting.
Well,
the same with lips, yeah. Like when you were doing
does it differently to me.
Yeah.
And I just can't quite achieve what she does with lips with a cannula. It just doesn't work.
Yeah. So that doesn't mean that someone is doing it wrong. They just have different technique. It's like with haircut.
Precisely.
You can achieve the same haircut, but using different technique.
Yeah.
Okay, doctor told her to have Botox under eyes instead of filler, because when she talks, the bag under her eye is moving.
No, that's politely that sounds like rubbish to me.
Okay, so she said, shall I ask for a second opinion?
Maybe, yeah.
Yes, you should ask for second opinion. Okay, my lovelies, I hope I've answered most of the, not me, Dr. Gorman answered most of your questions. We can't do it for much longer because he has to go and save lives now. So we will finish here. I might even do it into parts because God knows how long.
And if you want to send me little clips or there's questions we forgot to answer, I can just send it to you. You know, we could almost, if you need to, just do like a little Skypey thing where there's bits we missed, we can add bits.
Okay. So thank you very much for doing this.
Lovely to see you.
And you. So I hope you enjoyed these videos, well, 2 videos. Sorry about the quality of the sound, you know, it was very difficult. I had to travel to London with my equipment, and it's never the same where you do it like here where I normally do it. I had to use different microphone and all that. I also didn't get to ask him all the questions. I was very grateful that he gave me so much of his time, because as you know, I only went there for my checkup, and he agreed to do this video with me. I've learned so much. There is so much more to it. I think that these days we tend to treat the fillers and the Botox just like putting makeup on, but as you have heard, you do need a lot of skill and knowledge to do it. So choose your practitioner wisely. Also, because I'm just a one-man band, I couldn't keep an eye on, I was deep in conversation and talking, asking questions, and I haven't noticed a couple of times my camera has stopped, so I've missed some bits. There was a really good bit of him because he took some pictures on his iPad before and after, and they were pretty good because when I look at myself I can't really see big difference, but when he showed me the pictures, hopefully he will send me those photos, so I might show you at some point later on. You could really see the difference. So like even from the front, my face looked so much flatter and almost like, not very sagging obviously, but everything going south, looked a bit dragged down, and then after you could see this lift. So I could see definitely the difference with the cheeks. The chin wasn't such a big difference because, as you know and you've heard in a video, we didn't get the chin exactly how we wanted to, but that's probably my fault because I already had some filler here. So I'm very happy about the jowl bit, but we're going to fix the chin. But I'm talking like year down the line. I'm not touching it anymore, not doing anything more to it. Also my nose, I had tiny bit on the tip of my nose and here, and I couldn't see the difference because I never look at myself sideways, I don't look at my profile, but in a picture, especially my tip, I never thought my tip definitely looks a bit more pointing downwards on that picture, and now it's a bit up. So they are very subtle differences, but they make you look fresher. And I think that's the thing, when you go in for things like that, it's not to make you look totally different, and you don't want people to say, oh my God, you had your face full of fillers. You just want to look fresher, a bit more lifted. Okay, my lovelies, thank you so much for watching and stay fabulous. Bye.